Then onwards, I started my career as a professional radiologist. I worked with the Tatas in their main hospital in Jamshedpur. Then I went to the abroad and I worked in the Kingdom of Saudi Arabia for a very longer period, around about 18 years. Then I came back to India. I worked in Delhi, working still. I worked with Holy Family Hospital. I worked with SRL Diagnostics. And at present I am working with the HCL and here in the Lord's Clinic. I have ultrasound clinic over here in the Lord's Clinic, and we get all types of patients. Mainly I just wanted to focus on the obstetrics ultrasound. We are a very helping tool in the management of the antenatal checkup, which you call for a man knowing about the status of the pregnancy and from the period of the conception, and just after the 4 weeks of the conception we can tell the patient that yes, you are pregnant. And what are the from onwards we scanned. First we see whether this is the intrauterine pregnancy or an extrauterine pregnancy, which is very important for the clinician to know, and by only clinical examination they cannot know it. Then onwards we start. First we see at between the 5 to 6 weeks a sac. Then we see whether a yolk sac has developed. Then with the yolk sac we see with the embryo has come. Then we see whether the cardiac activity is. At the 12 weeks we see two things of the fetus, which is very important to rule out any congenital anomaly the fetus is getting or it is acquired. One is we see the knuckle thickness, which is called the fold of the skin at the level of the neck. Then we measure the nasal bone. Sometimes in the so many varieties are there where we don't get the nasal bones. So we write and the gynecologist acts accordingly. Then at the level of the 18 to 22 weeks we do complete ultrasound, which we call level 2, which is to rule out any anomalies which are there. There are certain things which we have to look in that, like the spines, the head, and what are the anything in the brain like ventricles we see, whether it is a hydrocephalus or any other, so many anomalies are there, we rule out. Then in the spine we see, then we go to the abdomen and we see the kidneys, stomach bubbles are there, urinary bladder is there. So we go other extremities, we see all the long 12 bones, which is very important, whether all are there or not. Then we see digits, hands and ears, eyes, but only in the eyes we are seeing, but we don't know the vision. Sometimes the patient asks whether my coming baby will have a normal vision or not. That we cannot predict. And second, also we cannot predict about the hearing. We just see the ears. We don't know whether it is there, hearing power is how much. Then this all, then till for 38, 39 weeks we do scanning and we guide the gynecologist. Second thing, one thing I just wanted to mention here, the placenta. It is a very important thing, which is the main blood supplier of the fetus, and which if it is descending down, we write that it is a low-lying placenta. If it has gone very low and it is covering the os, I cannot in very detail go to the anatomy of the female genitals. So in that, if it is going very low and covering whole of the os, we called as a placenta previa, which is little dangerous, and sometimes patients get very lots of bleeding, which we called APH, antepartum hemorrhage. Then after pregnancy also there is an hemorrhage which is called postpartum hemorrhage. That also we can see after that when during the period of the postpartum, means that after delivery, is there any collection, clots, so that they can get it clean. Now after obstetrics, there are abdominal ultrasound for all, like in male or females, everybody. It is all same, but for the doing an abdominal ultrasound, the patient needs fasting, and it should be 6 hours fasting, because if 6 hours is not there, gallbladder we cannot see well, and sometimes gases are there. If he is fasting, then there is a less gas, or then we will do a scan and we see all the organs of the abdomen. And nowadays, like in India, we have a plenty of cases of kidney stones or gallstones as well. So these things has to be ruled out. Thank you very much.